The EMR, or the electronic medical record portion of Office EMR, is the area in the system where all of the clinical data is stored for any of your individual patients. This is the area of the system where you would go to document a visit or maybe even pull up information from previous visits, their allergies, their meds, their problems. All of that type of information is stored in the EMR. So this video will cover the basics of the EMR, how you navigate the different tools that you have available, and the basics of documenting a visit. Now, it's important to remember that every office is unique. So you will have your own workflow, your own templates that have been customized specifically to you. This will just give you an example of the types of data and where that information might be stored. So to begin, the first thing you're going to do is select the EMR button in the lower left-hand corner of the screen. In doing so, you will see this screen load. And just like many of the other areas of the system, you'll notice you always have this navigation pane here on the left-hand side of the screen. And remember, it consists of 3 areas. You always have your task list. Those are the things that are unique to your login. And then in this instance, you have a calendar to determine which dates worth of patients that you're seeing. And you can navigate the calendar using the arrows here or selecting different dates on the calendar. And in doing so, you see different patients load here in the middle, here under the clinician's schedule section. Now, if you decide you need to actually change that schedule, you can select clinician's schedule here just underneath the calendar, and this will allow you to switch between different providers' patients. So if you're a nurse or you work with several providers' schedules, you can bounce from one to the next. Just below that, you have the ability to turn on different options. If you, for example, do not need to see the chief complaint, you can uncheck that, and you'll notice that falls off the screen for that individual appointment. Just below the clinician schedule, you have your hospital rounds. So if you see patients outside of your office, maybe you round at a hospital or a nursing home or something like that, you can track that schedule in the system as well as the patients that you're seeing in an in-office setting. Okay. Now that I have the appropriate date selected, the appropriate provider selected, again, I see all of the patients on the schedule for that day. So to begin by documenting that visit, I would simply select this appointment and all their information would load to the right. Now that process is very important. The way the system ties all of your documentation together is through this appointment. So for example, if today was actually the 30th and you forgot or didn't have time to document for this visit on the 23rd, you wouldn't want to just open this patient up on the 30th and begin documenting because that information would not be correctly tied together. What you would need to do is change your date on the calendar back to the date of the appointment and then select that patient from their appointment. Again, all the documentation that you're about to do would be then tied back to that appointment date. So now that I have the patient selected here, a couple of the things that you may notice, if you had a very long list of patients on your schedule, you could use these navigation buttons here to go up or down in your list of appointments. Okay. And again, once I've got the patient loaded, then all of his information will be loaded here in the EMR on the summary window. So the first thing that you will always see is this summary. It's a snapshot of this patient's chart to date. So in this instance, right at the top, we can see the big 3, the allergies, the medications, and the problems for this individual patient. Now you'll notice there's little tabs that hang down from each one of these. If you select them, you have the ability to navigate right to that particular tab. So for example, if the allergies have changed and you need to go edit those, you can open the allergies tab and fix those right from there. Or if this had been a new patient and he did not have any allergies, then you could simply select no known drug allergies and it would add it from here. Or if you have looked at this and this list is accurate, then you could simply select reviewed and you'll notice it says reviewed today here at the bottom of this section. So anyone else that opens this chart will know that these items are in fact up to date. That same logic holds true for your meds and your problems. Now, just below those 3 items, you have the timeline. The timeline provides you a significant amount of data all in one spot so that you do not have to go from one place to the next to figure out what has been going on with this patient. The timeline gives you a chronological view of all the information that has been added to this patient's chart. So just as an example, I can see that a note was created here on 8/13 for this patient. And then a secondary note was created on 8/22. Now, in between that time, a document happened to be scanned in, which was a CBC result, and there was a communication with the patient, all right, asking the patient to follow up there. Now, there could have been lab results that dropped in here. There could have been new immunizations or maybe medication changes. All of those things would be visible here from the timeline. And each one of these, you would be able to see more detail by selecting it. So for example, if I come back here to this date here, I can select this note that Kim created and see all the information that was documented. Again, I could see any immunizations that happened to be added. If I wanted to see this patient's vitals, I could select this. This will allow me to see their vitals and their medications over time, along with any key lab values. So I could simply see this patient's blood pressure, or maybe I really cared about his weight. So I'd get rid of the blood pressure. I can see how this patient's weight has changed over time in coordination with his medications. And maybe I even would like to add a lab value to that. So I'll select this patient's glucose. And so now the glucose is added here in purple, and you can see those in coordination with any of these other points. Additionally, on the timeline, you'll notice there's always this section for a nurse's note. This just gives you a snapshot of what has been put in the chart up until this point. So if anyone has added data, allergies, meds, problems, etc., you don't have to click through all the tabs where they enter that data to see what it was. You have one spot that you can select nurse's note here, and it's going to build this note and show you what someone else has put in up into this point. 2 other items that you'll notice on your timeline are your med reconciliation and your decision support. The med reconciliation tool gives you the ability to quickly reconcile meds, allergies, and problems all from one screen. If you happen to receive a continuity of care document from another EMR system and imported that, you could reconcile the meds, allergies, and problems that you have on file with what they've provided. The decision support tool gives you the ability to see any predetermined alerts that you've set up based on any number of clinical data points and any actions that you might do based on those support rules. Okay. So now that you've actually seen the timeline, you understand what's going on with the patient, you're ready to begin documenting a visit. And that's done by using one to many of the chart tabs on the right-hand side. Now, in most offices, the workflow is that you work through the chart tabs that you're assigned. Maybe you're a nurse, so you have 2 or 3 of them. You're a provider, you have 4 or 5 of them. Every office is a little bit different. All right, so you would want to document just the appropriate information using the chart tabs on the right. And as you've done that, eventually we're going to create a super bill, which is essentially the claim for a particular visit, send that over to the billing department. And then we're going to create a SOAP note, which pulls in all the information from these individual tabs into a single readable format that can be signed off and ultimately creates a note on the timeline like we saw just a second ago. So we'll look at data and how that's been put into each one of these tabs and how these might be used. So vitals, for example. So we were able to capture the patient's vitals for this particular day. Now you'll notice at the top of the screen, there's always this toolbar that is always available. I want to look at each one of those items and talk about how they will be used. So for example, the first button you will always see is a new button. So if you, for example, have already created a set of vitals, you could click the new button. It clears those vitals out and allows you to capture a new set for a different time period. So imagine you take vitals at the beginning and at the end of the visit. This would allow that to happen. The print button would print whichever window you happen to be looking at. So again, we're on the vital screen, so clicking print here would print this window. If we were on the allergies window, that would print the allergies. The third button that you have is a save button. So this will save whichever section you happen to be on. So remember, we're on vitals. So imagine I add a new value here. If I want this to be a permanent part of the record, I will hit the save button. Okay, so that is now part of this record for today. Additionally, you have a save all button just to the right of the single save button. That's sort of a fail safe. So if you have documented several chart tabs and you can't remember if you've saved them, you can click the save all button and it will go and get all of those for you without you having to go back to any of the other tabs on the right. Additionally, you'll have this green circle with a clock inside of it. This is the history button. So most windows have two sides. They have a summary, which is what we're looking at here, where you enter data. And then if you click it or you select this drop down, you can display the history, which shows you a record of every previous data service that was entered. And from the history, you would be able to double click on any one of these items and pull it forward to see what the full record. To get back to the summary, you simply click that drop down again and say display summary. The next button we have here doesn't apply to this particular tab, but this is a load defaults button. So some templates have defaults, which means certain boxes get checked or filled in with data based on some predetermined rules. So if we were on, for example, the review of systems and we select the defaults button, several normal values might be selected, and then the provider can document via exception, go back and just put in those items that are not normal. We also have an encounter date button. So this encounter date is driven by, let me expand this section over here, the date that you have selected for the appointment on your calendar on the left-hand side. So that's what originally dictates this encounter date. However, you can change it if you need to, along with, in this case for vitals, the time that you're capturing that particular set of vitals. The next item you have is an audit trail. Everything you do in the system is tracked. Selecting the audit trail will allow you to see changes that were made in the exact time that happened to take place. The next part we have here is the index card. So selecting that will just give you a quick snapshot of this patient's demographics. And always next to the index card, you'll have a drop down with some additional patient actions. So for example, you may decide to open up the patient's comments or alerts and add a new comment or alert right from here. You could send a communication about this patient, which actually attaches a copy of this patient's chart to sort of an inter-office email that you could share with anyone in the system. Then you have patient communications. So that shows you every communication that was ever sent where this patient chart was attached. You can see the entire list of those. The patient setup window will open up the demographics area for this patient with their insurance, the responsible party, etc. The print queue will give you a list of items such as patient education, clinical summaries that have been queued up for this patient, again, based on some set of predetermined rules. As you're working with this patient, you may decide to add them to the recall list. That's a list of patients that you would like to call in the future, potentially to schedule an appointment. You weren't able to get them on the schedule right now. You want to call them and try to get them on the schedule when it works for them. We also have the ability to create a reminder in reference to this patient. So if we create a reminder right here, it'll bring up our standard reminder window and attach this patient's chart. If you would like to provide this patient with a My Medical Locker key, which is a unique code that allows them to connect their My Medical Locker with their chart within Office EMR, this My Medical Locker admin tool gives you the ability to see those keys, create new keys, and print a copy for the patient. And then lastly, you have the ability to close this patient's chart if you so choose. Okay. And then lastly, you have a link to the training. So if you select this button on any screen, it will give you a training video for that particular area. So again, as we move through these different chart tabs, all these buttons will be available and will apply as necessary to those particular areas. So the next tab that we will select is the History tab. Now, history is slightly different in Vitals in the sense that it is historical, meaning any data that you would have entered at a previous visit would automatically show up here and be ready for you to edit or review. Now, Vitals is encounter-based, so each time you open that tab, it's blank, expecting you to enter new information for that particular visit. So if you recall, Vitals had the History button enabled, so we could see all the previous dates of service that we'd captured information. History does not, because this is the most up-to-date current record. The next tab we have here is Allergies. Allergies gives you the ability to search through a list of codified medications and add them to this patient's allergy list. Very nice thing about this is this will actually cross-reference any medications that this patient is on and alert you if there happen to be any interactions. The next tab we have here is the HPI, or the History of Present Illness. This gives you a template to document this patient's complaint and any details about that particular complaint. So in this case, this was an acute visit for low back pain, and these were the items that were selected for this particular patient, and it created this nice summary window here at the top of the screen. Okay. This area also has a history button because this is encounter based, so if you want to see any past encounters, you can see those. Another nice thing about this is you have the ability to copy forward previous encounter-based templates to a current date. So for example, if you see the patient over and over again for a similar problem, you would want to copy forward your previous HPI or your previous exam and then just edit that as necessary for that particular visit. All right, we have a Review as Systems here as well, or an ROS tab. This gives you the ability to go through a series of symptoms that the patient may have had in the last few weeks and select either positive or negative. This is an area where, for example, we have a defaults button. So by selecting this, this may go in and load a series of no's that we have predetermined. This area also has the ability to copy forward an ROS from a past visit to a current one. The Exams tab is where most of the objective type information is documented. So in this patient's case, this is a physical exam that we've opened up here. So we can see what was specifically clicked as far as normal values. There were some abnormal items and then some details about those. And if I scroll through the summary here, I can see, for example, those abnormal values showing up red, bold, and underlined. Now that's just a feature of this particular template. So not all templates would do this, but we do have the ability to add that in there if it's something that you would like to have. Now, another common thing that you would do in exams is there may be several types of exams or objective type of information that you would like to document. So if you select the New button there in the upper left-hand corner, you'll be presented with the drop-down to allow you to see all the different templates that your user has access to. So if I would like to perform a diabetes evaluation for this patient, I can open that up, fill the information out, and then once that's finished, I could click the Save button to make that part of this patient's record. Again, this button also could potentially have a defaults and a history. And on the history, you'd have the ability to copy these forward. The problem list gives you the ability to manage the list of conditions that you are treating for an individual patient. So you didn't necessarily treat all of these conditions today, but you have diagnosed this patient with all of these problems and at one point in time or the other are treating them. So you can easily search a list of diagnoses to add to this list, Or you can always select the diagnoses from the list and edit it, add new notes so you understand what's been going on over time with this patient's condition, any little assessment, if you will. And then we have order entry. Order entry allows you to create tasks within the system. So for example, if you would like this patient to follow up in 3 weeks, that would definitely be part of your documentation. So that's why you select that here in the EMR. But additionally, you may like to task somebody in your office to actually schedule that follow-up appointment. So we may default this follow-up in 3 weeks to be routed to a scheduler or some specific person in your office to be tasked with this order to take care of that. Now, if you were to select the history button, you would see all of the orders that had ever been placed for this particular patient. And if you happen to have a lab result interface, you would see any results that may have come back from a lab. And you could select that result and you would see that information load here. We can see the abnormal items here in red and bold and any other lab values. The next tab we have is prescriptions. Prescriptions allows for everything medication related to take place. So if I were putting this patient's current medications, I could simply search for that medication and add it. I could write new prescriptions and either print those off or send them electronically to a pharmacy. I could refill prescriptions from here. I can stop and discontinue medications, all from within this one screen. So the summary allows for you to input the data, and then the history allows you to see that patient's med list and manage it, whether you're stopping a medication or refilling a medication. All of that can happen from the history window. The Super Bill tab allows you to put in, or at least begin, the process of creating a claim. So for example, we would select the appropriate CPT code here on the left from the procedures section, and then the appropriate diagnoses from the right. So that diagnosis can either come from the patient's pre-existing problem list that you established that we just looked at, or maybe you have some favorite codes set up. Those would be listed here as well. Or you could perform a lookup of any other diagnoses in the ICD-9 or ICD-10 list. Now, as you add these different procedures and diagnoses, they begin to create a charge summary here at the bottom of the screen. This allows you to see the CPT code and associate that ICD-9 code with it, and you can see the charge for that particular visit. You can easily edit the units if need be and add modifiers right from here. Then once you're done, again, you would save, and this could be released to your billing department, and they could begin working this claim and submitting it to the insurance company as necessary. The treatment plan tab allows for a lot of the counseling. Now, the actual plan could have been some orders and any new prescriptions that you might have written. The treatment plan tab itself allows mostly for counseling. So, for example, if I open this up, you'll notice I recommended that the importance of medication adherence and our typical discussion on controlled substances. And by selecting those two items, it's created this nice summary here at the top indicating that I did talk with the patient about these two items. Again, like several of the other tabs, you have a history button here where you could copy forward any previous templates. So now that you've worked through the different tabs and you've documented all the information, now we're ready to move to the SOAP note. The SOAP note is the area of the system where all that information is sort of downloaded or put together in a readable format. So you can see we have our subjective section here, which includes the patient's problem list from that problem list chart tab, the chief complaint, which came from their appointment, the history of present illness, which came from that HPI tab, the patient's entire history, which came from the history tab, his review of systems with any abnormal items there in the red and the bold. That was the ROS tab that created that. Then we have his allergies from the allergies tab. And then there are current medications. So that's any prescription that was entered with a status of current. Now we're starting to move into the objective portion of the note, which includes the vitals that we've entered from the Vitals tab, and then the physical exam from the Exams tab. And then we have the assessment, which includes the diagnoses and the procedures that came from the super bill. Now you'll notice that there's this small note, start on pain medication and begin stretching program associated with this lumbago. That was actually indicated back on the problem list with that particular ICD-9 code. And then we have the plan, which consists of your treatment plan, your orders, and your new prescriptions. So remember, the treatment plan was the counseling from this treatment plan tab. Orders came from the order entry tab. And medications came also from the prescriptions tab, but the difference here is that they had a status of new. So now that all that information is there, I've reviewed it, it looks good, I'm able to input my PIN number up here. This is my electronic signature. And then I would save that to lock that note down. Now, once that note is locked down, it cannot be changed by simply highlighting and deleting things or typing to add new information. Every change from this point forward is handled through an addendum process. So you may decide that some information is incorrect and you would like to strike it out. That's done using this S with the line through it to create the strike through. Or you may decide that you want to create new information. So that is a new chart correction where you're just adding additional data that may have been left out. So those would be the two ways that you'd be able to add information to the chart after it's been signed off. And again, just like the other tabs, you do have a history button here to see any note that had been created in the past. This green icon here indicates that it was signed off, along with who created the note and when it was created. So now that we've looked at the SOAP notes, that is typically the last thing that you need to do in the documentation of a visit. Now, outside of the visit, there are these other items that you might like to look at in regards to these chart tabs. So for example, letters. You may decide that this patient needs a school excuse. So I would pull up one of my standard letters. It automatically populated my logo, the date, the patient. All I would need to do is put in the date that I would like this patient to return. It's already signed my name down here. And I would save or print this letter. If I print it, obviously I could provide that to the patient. If I were to save it, this would route it to my checkout staff and they could print that at time of checkout. Again, we have a history button where we can see any letter that we've provided to this patient in the past. We also have a flow sheets chart tab. So any flow sheets that are assigned to this patient, either based on his meds or his age or many other clinical data points, we'd be able to see those from here by selecting this drop down. And we can either see a summary view of this information, which is just today's results compared to their most previous results, or we can see a flow sheet view, which is every single date that we've seen this patient and captured these particular items. And you can scroll through and see all those values. And if you decide you would like to graph that information, maybe just a couple of them, you would select them, right click, and then you could graph that data over time. And you also have an e-documents chart tab. So this is all of the patient's scanned information organized, in this case, by folder, but you can always select this and arrange this by date or by the name of the document or by the type. But for example, if I select the urinalysis for this patient, I can see that scanned in document that was provided to us. And then I have several tools to work with that document. I can zoom, I can rotate it, I can invert the colors or crop it. I have several different options available here, or I can even open this in its own window so that I have a larger picture of just this one particular image. Those are a portion of the tools that are available to you as far as chart tabs. Now, it's really important to note that this is not the full set, and this is not necessarily what you would see. It's important to us that everyone has a customized view of the system. They see what they need to see at the time that they need to see it. So what you'll notice is if you right click anywhere over these chart tabs, you have the ability to either display favorites, which I'm doing right now. I could display all the chart tabs, which you'll notice this list has increased considerably. Or I could set up my favorites, which would allow me to turn items on, turn them off, move them up or down in the list so that this order and this list of tabs made sense to me. In that same vein, the timeline allows that same option. So for example, if your office never receives order results or never gives immunizations, you can get rid of those lines by simply right-clicking and selecting Setup and turning those items on or turning them off. And again, you can move the order either up or down as you see fit. And one last feature that we're going to talk about here in the EMR is the EM coding section. So some offices have this, some don't. It's always an option to get if you would like it. This allows the templates to determine the level of service that you've documented. So, for example, we can see that the system is recommending that I bill a level 3 on the history portion, a level 4 on the exam portion, and iSalus will not recommend an MDM. You would be able to select that on your own. Now you can drill into each one of these sections. So for example, if I select history, that is actually comprised of the patient's HPI, ROS, past family, and surgical history. So anything in green is showing what I have actually documented and is codified in the system. So for their HPI, I've documented more than 4 elements. And so if I actually select HPI down here, you can see what elements I have or have not documented. Same thing with the review of systems. I can see specifically what I have or have not documented. And I can override these items if I feel it's inaccurate. So if I actually believe I've captured a history item, I could select that and override that information. Same thing with the MDM. I could come in here and learn more about each one of these things. If I knew what a limited number of diagnoses was, I could simply select that. Or I can select number of diagnoses at the bottom to read through the requirements and decide what level to select based on that. Okay. And by selecting these 3 items, it will give me an idea of what level of MDM I should be using. So from a very high level view, those are the tools that are available to you in the EMR. Again, every office is different. Everyone has different templates and different workflows. So it's important to watch a few of the other videos. Each one of these chart tabs will be broken out much more specifically, and you can learn a lot more.